All right, so I would like to introduce you to the hip equipment that we use for an anterior total hip. So this is the C-arm. This is the small x-ray screen that we have to utilize to see everything. When I'm using the Vision Pro goggles though, as you'll see in the surgery video, I can actually blow this up and make it a lot bigger and see the finer details, but with a standard hip, this is the screen we're utilizing. This is the machine itself. The x-ray beams, they come out of here and they get collected here. As it shoots through you, it projects this image up onto the screen here. So this is the C-arm portable x-ray machine. This is the HANA table, H-A-N-A. Pretty high-tech piece of equipment here. The legs can actually independently move in all locations. And then in addition, we can actually twist and rotate the leg in space like that, and so we can literally put the leg in any position that we want to, which helps with exposure. And so your feet go into these boots, and the boots then snap in here. The patient is actually secured here, and then there's this hydraulic lift here that goes down and then comes back up during surgery to help lift the femur up, and you'll see how we utilize that as well. Obviously, we've got the anesthesia equipment back here, and our scrub tech's putting everything together on the back table. So I want to show you some of the equipment that we use. So a lot of that we don't need to talk about. These right here, these are called the reamers. So when we're making the cup part, that will actually fit in on here, and then this spins around. It looks like almost like a cheese grater, but it's super sharp and creates a spherical hole for the cup to go into. So that's what we utilize. I usually use the odd numbered reamers, so a 47 millimeter, 49, 51, and then the cups are even, 50, 52, 54, and then it will wedge in there because it's 1 millimeter larger. When we get to the femur side, there are broaches. So the real femoral implants look a lot like this, but this will actually attach onto this strike plate here, and I can hit the mallet on that end and get it into the bone. And these have cutting edges on the sides, the back, and the front to remove the excess bone until we get to the nice hard cortical bone so it's sitting appropriately. And then we have all these trial necks. So if you'll put a trial neck on, put one on a brooch. We have different trial necks. Flip it upside down. No, that little, yeah. Usually I'm doing this and put it the other way. 108, yeah, there you go. So usually I do this part, so she's not as familiar. So kind of point it my way. So that's the neck that comes off. And then we have the head right here that just snaps on, and that creates the full trial, and that head will go into the cup, and then we'll look at it under x-ray and make sure we like it before we put the real thing in. So moving along, she's got the broaches. Those are the larger ones. We start out with the smaller ones, work our way up. This device right here is to help push the head in, help relocate the ball in. It's called a head ball pusher, so it pushes the ball in. And then we've got this, which is the inserter that the actual cup gets screwed onto. Then there's a bunch of retractor devices. We've got a saw to actually make the cut. And then this corkscrew right back here fits into the bone after we make the cut, so I can pull the remaining head out. And again, a few more retractors over here on this side. And that's pretty much the equipment we utilize for hip replacement.